Welcome everyone to another exciting episode of Tea with Hadidi. Today we are diving into a very touching topic. We are going to be talking about PCOS, meaning polycystic ovarian syndrome. This is a disorder, a hormonal disorder that affects up to 10% of women worldwide and often bring challenges like irregular menstrual cycles, fertility struggles, and metabolic issues. Today, our guest today, she's not only a pharmacist, but also a PCOS survivor. For women battling this disorder, this video is for you. Yes. Also for women out there who don't really know about this disorder, this video is for you so that you get to know more about it. So PCOS, she's a PCOS survivor, as I've said earlier. Her personal journey, we are going to be talking about her personal journey, her condition, and also how this affects women in general. So the person who is seated here next to me today, her name is Aisha Wakili from Aisha Wakili. Am I right?
Yes.
Yes. She's also a PCOS survivor. So please grab your cup of tea and let's get into this conversation. Okay. From Aisha Wakili. Today, can you share a little bit about yourself? Who is Aisha Wakili?
Okay. Like you said, my name is Aisha Wakili. And I am a pharmacist, a PCOS survivor that is helping women with this condition in Nigeria and abroad. And I was born into the family of 8. I'm the 3rd child. I was born and brought up in Zaria. I am Babu by tribe.
Oh, from Maiduguri, right?
From Maiduguri, but I speak Fulani.
I don't
My dad is Babu, my mom is Fulani, so we speak Fulani at home. Yes, and I attended Zaria Children's School for my primary education, then Model Learning Secondary School for my secondary education, all in Zaria, then Kaduna State University for my tertiary education. Yes. So that's basically Aisha Wakili.
Aisha Wakili.
Yes.
Okay, so we've heard your personal introduction. So can you introduce what PCOS is? Tell us what is PCOS. For somebody who is watching today, I'm also battling PCOS.
Yes.
Yes, I am also battling PCOS today because that's how I got to. Yeah, admit it.
Because a lot of people.
No, I have already accepted that. I am also battling PCOS.
Yes.
And I would like you to tell us a little bit, for somebody who is watching, who is a newbie today, somebody is there that she has never even heard of this PCOS thing before.
Yes.
Okay, so can you please tell us what PCOS is in general?
Okay. Polycystic ovarian syndrome. It is a hormonal disorder. It's an endocrine, a hormonal, and a metabolic disorder that affects women of reproductive age. So each women have ovaries, and these ovaries are responsible for producing eggs. So what happens in PCOS is that those eggs don't mature. Every month an egg ruptures to be fertilized. But with PCOS, a lot of the eggs don't reach maturity. So it forms cysts around the ovaries that causes the ovaries to enlarge. So that's why women with PCOS tend to have irregular cycles, experience infertility because no egg goes out of the ovary. So there's no chance of fertilization. Women with PCOS tend to have prolonged bleeding, no bleeding at all sometimes. They experience obesity, acne, hirsutism, hair growth on the face, and then alopecia, hair loss on the head. Those are the kind of things that women with PCOS experience.
Wow.
Yes.
Okay, so you are a survivor of PCOS.
I am. I'm so battling it.
Okay, so when you say syndrome, it's already part of you.
It's a part of you.
It's just for you to manage it, right?
It cannot be cured. It has no known cause. We are still yet to find out what causes it, and still yet to know what the cure for PCOS is. So it's a lifelong condition that can only be reversed. And if not treated, can cause further complications in the future.
Wow.
Like type 2 diabetes, cardiovascular diseases like hypertension, endometrial cancer, Alzheimer's, and the likes of it.
I've never heard of that Alzheimer's.
Alzheimer's, where forgetfulness.
Yeah, I know that.
There's brain fog associated with PCOS. So as time goes on, it affects your memory, your ability to remember things.
Oh, wow.
Yes.
Okay, so from Aisha, so what was your biggest challenge when you were first diagnosed with PCOS?
Believe it or not, it came as a relief for me when I got diagnosed with PCOS because I knew deep down something was wrong with me, but I couldn't place a finger on it.
To know what
it is. I have always battled with body issues. I had
get slim some days and something.
No, I was always a chubby kid growing up. I was always chubby, and then I realized that whenever I ate something that contains a lot of starch, I get lethargic. I get so weak that I just want to lie down. Or I see that with my cousins around and my sisters, I don't eat as much as they do, but I was always the fat one. Yes, and then at puberty, when my period came, after 3 months, it stopped coming. I was asking my mom, I thought it's a continuous thing. Every month it's supposed to come, but it wasn't coming. I just knew something was wrong. But I couldn't place my finger around it. So the diagnosis came for me as a relief, honestly. But then there wasn't a community or too much information out there. Yes, with regards to it. I think I'm the only one in my family that has it. So I went on a search rampage. But there wasn't something close by here in Nigeria, especially in the north. So that led me to my career path. I wanted to be So I wanted someone the way I needed someone at that time, the way I am right now for some people, because I know how lonely, it is. Yes. So that's my major challenge, not finding a community, not finding someone to talk to. But the diagnosis was a relief.
Yeah, for you to know, okay, this is what I have.
This is what I have.
How do we overcome this?
Yes, knowing the problem is halfway towards solving it. Yes.
True. Okay, so for those who are not really familiar with PCOS, can you tell us some of the key symptoms that impacts the health of women living with PCOS today?
Okay.
Maybe she doesn't know she has it, or somebody who is experiencing it.
Okay, so if you're trying to find out if you have PCOS, the symptoms to look for include irregular periods.
Yes.
If your periods are irregular, I suggest you go to the hospital to check your hormones. And if you experience hair growth on the face, facial hair where you normally don't have hair, if you tend to lose hair on your head, and then if you are struggling with weight issues, if you have the hormonal belly, that's it. Hormonal belly. Then I'd like to say trouble losing weight. I've said that earlier. Then acne. Yeah, some people struggle with cystic acne. And then if you're married and you're looking to conceive, a lot of women don't even know they have PCOS until they are married and are looking to conceive. That's when they are majorly first diagnosed with PCOS. So I think the telltale sign for PCOS should be your period, and then other symptoms that I've listed.
Oh wow. Okay, so let's talk about managing PCOS. You say it's a syndrome, right?
Yes.
This is not something you get cured from.
You don't.
It's already part of you.
Yes.
Okay, so we're talking about managing it. The strategies to follow to manage it. Because it's also a strategy, right?
Yes.
And also, when I was reading about PCOS, I came across the fact that some PCOS are not even the same.
There are different types of PCOS.
Okay.
But the major type of PCOS is insulin-resistant PCOS.
Yeah.
There's post-pill PCOS.
Okay.
That is caused by taking pills, contraceptive pills. There's inflammatory PCOS.
Okay.
Yes, but the major PCOS is insulin resistance because it's the one that affects the majority of women. And for even in the other types of PCOS, insulin resistance is also there. So it encompasses all the PCOS types.
It's just insulin resistance.
It's insulin resistance.
Okay. So what are the key strategies you've adopted to medically manage PCOS?
Okay. Medically, most women with PCOS are vitamin D deficient.
Okay.
Yes, it causes vitamin D deficiency. So I would always suggest medically, pharmacologically, for someone to invest in a good vitamin D supplement. Then inositol, it is very good for improving insulin sensitivity. So I would advise women to go for these two supplements. And then magnesium glycinate, it really helps as well in when it comes to hormonal production in the body. And then the exercise and diet in PCOS are the most important aspect of it, because at the end of the day, we are what we eat.
We are what we
eat. So one has to take into cognizance what she takes into her system. You have to devoid yourself of processed carbs, focus more on proteins, go for walks, move your body. Sometimes you won't feel like it, but you have to.
True.
Yes.
Some people feel this exercise thing. When I was talking to somebody about weight loss, she was like, it's high time people start accepting the fact that weight loss journey, not weight loss alone. Exercise should be part of your life.
Like the way we brush our teeth. Every day we should move our body. Our bodies were designed to be moved. That's why we have joints. We were designed to move. Yes, our forefathers were cavemen, hunters and gatherers. They moved. And if you notice the rate at which people are getting sick and the amount of hormonal imbalance we have right now, it's on the increase because we have become sedentary. We don't move. There are a lot of junk food. Our forefathers ate real food. So we need to move. Even as simple as a 30-minute walk a day. It's very much okay to improve your insulin sensitivity and do a lot of wonders for you. Be it if you have PCOS or without PCOS, you should move and then make sure that what you're getting into your system is good.
Welcome back, people. Okay, let's move on. So we are together with Pharm Aisha, if you're joining us here now. And if you're seeing us here for the very first time, we're talking about PCOS today. So moving on, let's talk about diet and stress, or exercise and stress. So I know it's not the same.
It's not.
For me, I'm a makeup artist. I go down the stairs from my studio to my car, sometimes come up. Let's say I go down the stairs, come up 2-3 times in a day, and people be like, it's because you're even working hard. That's why you're still you exercise. Yes. And I know I go for exercise, I go for gym and everything. So I feel if that is stress, if that is going to be okay for me, how do you know the difference between you're supposed to exercise and
so what you're going through, going up the stairs and down, that releases cortisol. It's stress.
Okay.
Yeah, that's the hormone for stress. When you're stressed, you release cortisol. After exercising, you release dopamine. Dopamine is a feel-good hormone. Yes, you feel good. We have a reward center in our brain. So once you work on yourself, when you do something positive, it's rewarding. You feel good after exercising. Yes. So stress is different from exercising. Even though going up and down is very good. It's better than seated, just doing work. The activity is good for you. But then I would like to talk about stress when it comes to PCOS management. So when you're stressed, your body is in survival mode. When your body is in survival mode, it won't give your body the chance, it won't give your hormones the chance to procreate.
So
you're stressed. How can you conceive when you're stressed now? So you need...
I not understand.
Yes, but there's a mechanism to reduce stress. Like, it's the job you do. Stress is part of our everyday lives. It depends on how we handle it. So there's this thing I watched where we maneuver our body to relieve the stress. You take 6 deep breaths, like for 6 seconds. You count 1, 2, 3, 4, 5, 6, and then you breathe out to rewire your nervous system to make you calm.
Okay.
Yes, and then you can practice what do we call it? Meditation.
Meditation.
Yes, take a few minutes, meditate, come back to your ground state, and then you proceed with life. Because we can't do away with stress as human beings. Stress is part of us. So we just have to find ways to overcome it.
Overcome it.
Yes.
Okay, so you should know that exercise is different from
Activity, normal activity.
Yes. True. Because when you're active, that's your survival. Your body is trying to tell you, okay, I know you're active. Let's go into survival mode, right?
Yes.
While for the exercise, you know, it's releasing dopamine and it's making. That's the summarized version from my own side. That's how I understood what she just said now. Okay, so empowering women, about empowering women. You are hands on deck with this PCOS thing. You have an Instagram page.
Yes, I recently opened the foundation as well.
Oh wow,
for PCOS.
That's beautiful.
Jasmine PCOS Foundation. Yeah, you get to know of it.
All right. I can't even wait because you know when you're battling something, when you have a community, you feel good about it. There's this, I don't know. Okay, so you are actively on deck supporting women with PCOS.
Yes.
Every time.
Yes.
So, what initiatives or advice you have for women struggling right now? What are you doing on ground? Do you have any projects?
Yes, I recently opened the foundation, the Jasmine PCOS Foundation. It's a small, it's my baby right now. You should get to know of it. And then I try to, as much as I can, use my Instagram page to offer public awareness and then campaigns to educate people, the ones battling with PCOS, and even those that don't have PCOS, especially men, because a lot of women tend to struggle when with husbands that aren't supportive or families that aren't supportive. Some think that you're overdoing it or you're looking
for a way to escape.
Yes. So I try to offer education because at the end of the day, there's a social stigma as well when it comes to PCOS. So I'm trying to work as much as I can to eradicate that stigma by offering education when it comes to it, because a lot of people don't even know they have it. A lot of women have it and are undiagnosed, and even those that even have it and are aware of it don't know the steps to take into like and I'm trying as much as I can to prevent PCOS from becoming a serious risk in the future, because if it's allowed, if it's been untreated, you're going to develop complications that will warrant you to take medications for life. So that's why we're trying to navigate. Yes, so my major initiative is just awareness and offering education to those women and the public in general. Yes.
Okay, so if someone is now diagnosed with PCOS, what's the first step, the most important step that person is supposed to take?
Okay, I think when someone gets diagnosed, they get scared. They feel like it's a sentence for infertility. They won't have children. They won't live a healthy life. I'll tell them to calm down.
Calm down.
Yes, it's not easy, but you should calm down. You should know that, find a society, find someone to talk to, and then start by changing your lifestyle. Lifestyle modification is the most important aspect of treating PCOS. What you eat, the exercise. I cannot overemphasize on what we eat, because what we eat is the most important thing.
What you eat.
Yes, and especially with PCOS, you have to watch what you eat. So I would tell them to completely modify their lifestyle. Yes, and then find a community Find someone that you can talk to, someone that you can vent to, at least someone that understands what you're going through, not someone that will brush over your feelings. I know a lot of women that
somebody is going through
that
the
said
same.
they are done talking to their family about it or their husbands about it, because at the end of the day they don't understand them and they feel like they are doing too much, so they shut down. You're going through this with no support.
And be like, let's just let it be.
Yes, let's just let it be. So that's not a nice thing. And then a lot of marriages are dying due to PCOS.
True.
Yes, especially in the north, especially those in polygamy. If he already has a wife that has given birth to children, and then you're dealing with it alone, he feels like, why did that woman has other kids? A lot of men feel like those with PCOS are overdoing it.
Too much.
Yes, or it's all in your head. It's actually not a real thing. Even the educated ones amongst us feel that way. So we have to try and offer education and enlighten people about it.
Okay, so thank you so much
You're welcome.
for all of this. And for someone who is watching today and you have this syndrome PCOS, or you from the symptoms she has mentioned, sometimes it might not be PCOS, but
sometimes it can be like some can have facial hair, and it's simply maybe high androgen levels. So not all the symptoms are PCOS. So I would advise, if you have any of the symptoms I listed earlier, you should see an endocrinologist. They should take your blood and run a hormonal assay on you to check for elevated androgen levels, elevated luteinizing hormone and follicle stimulating hormone, and then they should carry out a pelvic ultrasound to check for your ovarian morphology, to see if you have cysts. You can have PCOS with no cysts in your ovaries. Yes, so it's a very, very tricky thing. It's a complex disease. Yes, so you need to dive into so many areas to get an official diagnosis most times. Yes,
for you to know this is it.
Yes.
So if you really want to have that community, somebody to talk to, her Instagram handle, we are going to be leaving it down below for you guys to see. You can go follow her or send her a DM. And of course, she listens. Seriously, she listens. She listens so well that immediately you send her a DM, she's going to respond to you. That was how I met her too. And so for us to wrap up the final piece of advice, what do you have? Tell us, is there any advice you have for women battling who is on this journey on their own?
Yes.
Or
I think
any advice?
Yes, I would like to tell women that your PCOS matters, not just when you're looking to conceive, because we tend to center it around infertility. Infertility is just an aspect of PCOS. So take into cognizance all your symptoms, because if you don't take this step now, you don't want to end up with endometrial cancer, type 2 diabetes, or hypertension. Yes, Alzheimer's. Like, act now. PCOS is not something you put into your to-do list
and say, let me do it later.
Start taking small steps. Yes, those small steps will amount to something big in the future. So no matter how little, if you are going to change what you eat, start reducing the amount of carbohydrates you take, eliminate carbonated drinks, take small steps each day. Like they said, few drops can form an ocean. So just start something. Just don't center PCOS around infertility. There are so many aspects of PCOS that needs tending. I think that's the advice I'm going to give women.
Okay, so for our healthcare as a community, as a country in general, what do you think the community, what do you think is going to support PCOS, women dealing with PCOS in Nigeria?
Yes, I think there should be public awareness campaigns.
The way breast cancer campaigns
to educate the masses on PCOS, because it's something that needs to be heard. Also, free or subsidized medications should be offered to those women with PCOS, because most of these medications used for PCOS are imported, and with the exchange rates, they are really expensive. Yes, so if the government can subsidize those medications for those women, or subsidize IVF treatments for those women, for those that have tried and are unable to conceive on their own. That would be very good to help a lot of women. And then the cost of diagnosis is also expensive. Because if you're going to take hormonal assays, those are expensive as well. So especially for those in the rural communities. Yeah, so there should be advocacy for funding to provide free subsidized treatment and diagnosis for women dealing with it, and then there should be education for healthcare professionals on how to manage PCOS, because mostly when you go to the hospitals, they don't even tell you come back when you're looking to conceive. If you're a young girl that isn't trying to conceive, they tell you to go and come back, or they give you birth control pills, or you're given metformin that comes with a lot of side effects. So there should be education to the medical personnel as well on how best to treat women with PCOS, because PCOS is not a one like it's not each person with PCOS has different symptoms. You see, you have PCOS, I have PCOS, but our symptoms may be different.
Yeah, definitely.
What we go through may be different.
I have somebody that is very slim.
Yes, that's lean PCOS. Yes, so it's not a one tailor fits all kind of disease. It's individualized, so the treatment as well should be individualized, not generalized.
True.
So I think that's how the government can come in. I'm working on that as well. Let's see. With my foundation, I'm hoping that we'll get to bridge that gap.
Inshallah. Most especially in the north.
Yes, in the north.
But we tend to be last in everything we're doing in this country.
Yes.
Thank you from Aisha for coming for today's episode.
You're welcome.
So PCOS is just a syndrome. Let's call it just a syndrome. It's up to you to make it a lifestyle, to start making lifestyle changes in your life today. So you can go follow her on our Instagram page. Thank you for watching today's episode. Please don't forget to like, comment, and share this video. Who would you like to see on this journey? I'll see you on my next one. Bye.